autonomous system. So the robot doesn't operate by itself. The robot does what you tell it to do as a surgeon. And it's almost like, when you play games on your phone or you play games on the TV, when you move your joystick and the character on the TV screen moves backwards and forwards and left and right, it only moves by input of the person at the controls. And pretty much the same concept with robotic surgery as well. The thing with robotic surgery is that the patients have very small incisions. Now, back in the day when we operated for prostate cancer, the patients had a large incision from the belly button right down to the root of the penis. The abdomen was opened and stretched.
Like a flap.
Like a flap, yeah. Okay. To get the surgeon and the assistant surgeon's hands in there. The instruments were rather large. The scissor, for example, was the size of a medium-sized household scissors. Now, with robotic surgery, we put 5 little cannulas, which are tiny, that we put through the abdominal wall, get into the patient's abdomen, and the surgeon then has a 3-dimensional magnified high-definition view of what's going on in the patient's abdomen.
So it's a keyhole that's literally made.
It is real keyhole surgery. But the best part is that the tips of the instruments rotate far more than the human hand can. And in so doing, it allows the surgeon to get into deep recesses of the pelvis where the human hand cannot get in. And by doing that, we are able to perform surgery more meticulously, with less blood loss, with better cancer control. We're able to preserve nerves that go around the prostate to feed the penis, that are involved in patients' sexual function. So after removal of the prostate gland for prostate cancer, the patients can still enjoy a normal, healthy sex life. And the other thing is that patients don't have incontinence of urine because the surgical technique is so meticulous that the risk of urinary incontinence is far, far lower than was with conventional surgery.
So you're saying there are definitely more benefits to robotic surgery than not having it. And I'm just assuming, visualizing the flap in the old days. So minimal scarring, because you're looking at, as you said, 5 keyholes?
Yep.
So minimal scarring in terms of that.
And with that comes minimal pain, because you don't have a big scar. Your hospitalization, previously patients would be in hospital for about 7 days.
Reduced risk of complications?
Absolutely. With open surgery, patients would routinely need either a blood transfusion, where they take the patient's blood, recycle it and pump it back, or blood from the blood bank. With robotic surgery, the need for a blood transfusion is almost 0%.